Hi everyone. Today we're going to be talking about a downward spiral, which is a case study in homelessness. My name is Hannah Gove, and I'm a second year OT student at Grand Valley.
My name is Hayden Ramso. I'm a first year public health candidate studying epidemiology.
Hi, my name is Trevor Aukerman, and I am a first year student in the Masters of Athletic Training program.
And I am Taylor Baker, and I'm a second year student in Grand Valley's athletic training program.
So for the primary IPE learning objectives, we thought that there was 3 that stuck out to us. So values and ethics was the first one. We want to make sure that each patient has their own values, beliefs applied to the care that they're receiving. So we want to make sure we don't treat the condition, but we want to make sure we treat the patient with the condition. The next IPE learning objective is interprofessional communications. Because communication with families, patients, and healthcare providers is important in improving the patient's health and the continuity of care. And this could also involve teams and teamwork because this involves collaboration among professionals. And the last is roles and responsibilities. Healthcare professionals need to know their own individual roles and what they can provide for the patient. So a healthcare provider is not as smart as an individual, but they're smarter when they're acting as a team. And the promotion of the patient's health through continual reassessment and treatment provided by each healthcare provider is extremely important. And the establishment of patient goals that center around what the patient wants and clinician goals, which center around measurements like the clearing of John's cellulitis in this case.
Before we go into the question, I just want to give a little background knowledge on John. He's a middle-aged man who lost his job recently. He is, because of that, he's having lack of finances, and that's kind of blown up his life a little bit. He's starting to have anger outbursts, and his drinking went from not very much to more frequent now. And because of this, his wife has taken his children and moved out, and he's unable to pay his rent. He started to stay on people's couches, but he's burning bridges with them because of his alcoholism that he's dealing with. He has been to the hospital numerous times for different injuries, ranging from skin infections to just physical beatings and just other a constant cold. And each time they have just discharged him to home, even though he doesn't have a home. So the first question is, what are some key pieces of information that were covered within this scenario? And I just we split it into physical and mental health. So he, before his layoff, he had health insurance, but never had to use it because he never really had any major health issues. He is an active smoker, but before he only drank socially, and now he's doing it more actively. And then he has lost his family because of his change in habits since losing his job. And then, as said before, he's dealing with some skin infections that developed into cellulitis. He's got some colds that won't go away. And then he also has taken a physical beating recently. And then his mental health, that he's dealing with just the state of mind from losing his job and losing his family, being disconnected from them. He also has poor hygiene, which because of the situation where he's living in, and he now has lack of self-esteem because of those hygiene problems. And then he also has a lack of self-esteem because he was physically abused by some teenagers and is now dealing with those physical injuries as well as the mental injuries. And then he also has a lack of trust in healthcare workers because each time that he went to get help, he was just discharged without actually being helped, all of his needs being met.
So for question 2, we had to choose which professionals to include in this case study. And we split it up into two time frames. So the first is short term. And the first healthcare professional that is likely to see John is a social worker. Social workers are the John Stockton in our professional needs because of their ability to assist and refer. And as some of you may know, John Stockton was a great passer in the NBA. So generally, a social worker is someone that is equipped with restoring the basic needs that a person lacks. So in John's case, he might need some mental health improvement. He might need housing or care that is provided for low-income persons. He might need a support group. The next short-term time frame professional is a low-income PCP. So this is someone who can provide care for John, or even in like a walk-in clinic for free care because John does not have the funds to pay for prescriptions and treatment. And then there's long-term professionals. So like an AA support group could help combat John in his alcoholism battles. So just the use of team dynamics can help support each member in that group with their battles of addiction and give them strength to combat their past alcoholic tendencies. And the last one is occupational therapy, our therapist. They help set newer, healthier routines for a better lifestyle and get John back to the lifestyle he wishes he had before.
So I'll be talking about how would an interprofessional care team best serve the patient's needs. So if we were to set up a clinic, such as a healthcare clinic for homeless people, the people that we would want to have on our team would be a physician assistant to care to John's physical needs, such as the cellulitis that he infection that he is experiencing, and also he contracted a cold and flu, and we wouldn't want that to progress either. So whatever physical needs that they need help being taken care of in order to be medically stable, we would want the physician assistant to help address that. John has also been through a lot of trauma in a short amount of time by losing his job, losing his family, battling addiction. He was robbed. He's been through a lot. So we would definitely want to focus on his mental health and bring in a counselor to help process through those emotions and those negative feelings that he may be encountering could really help him. Also, a social worker or case manager could be really beneficial in this type of team to help address resources that could help John in such as going to AA meetings and locating those meetings so that John can have a social group to help support him of people who are going through similar experiences, or even providing housing options that are affordable, such as affordable housing or even a recovery home that are also filled with people who are also battling addiction, like John. And lastly, we would like to have an occupational therapist on the team to help establish some healthy routines again in his life and get back to the things that are most meaningful to him, whether that's rekindling with his family or finding work or finding housing. An OT can help him in all those aspects. And an OT can also help him with his hygiene because that's something that's lowering his self esteem, his medication management is something that he seemed to struggle with because he wasn't taking his meds on time, which helped progress the cellulitis infection. And so, this is the team that we would like to have to look at people in a holistic way and provide an interprofessional collaboration to best serve the patient's needs.
So looking forward at how John's health has changed 1 year later, 1 year may not show significant changes in his alcohol consumption or his smoking habits, but he now has a toolbox of resources and people to advocate for him that will benefit him in the long term. A social worker or case manager would be able to help him enroll in Medicaid, and with health insurance, he can then seek care at a local primary care clinic to improve the continuity of care he receives. A PCP or a PA could provide treatment for his acute infections, routine screening as part of preventative care, and education about smoking cessation and the effects of alcohol abuse. As Hannah mentioned, an occupational therapist could help get him back into a routine that works for him to foster healthier behaviors and improve his quality of life. The interprofessional team provides him with consistent, cohesive care that he was not receiving before. There was many missed opportunities with healthcare providers when he went to the ER, and no one recognized that he was homeless, so there was never any follow-up because he was discharged. A consistent team can monitor his progress and provide the support he needs and has been lacking in. He now has more comprehensive resources. A social worker can direct him to a local AA support group to work on his alcohol dependence and expand his social network. The social worker could also provide references to local community organizations for additional support. One of those local organizations is Well House. They are a Grand Rapids organization whose mission is to provide housing for the underserved. Another is Care for Friends. They are a Chicago organization which provides folk care clinics, weekly hot lunches, and monthly health screening clinics for homeless individuals. And these are just a couple of examples, but there's many similar organizations in different states and cities. A larger network of resources and support means that he now has access to more housing resources and nearby food pantries. A real world example of John is a patient that I encountered at my most recent job. I worked at a specialist clinic, and one of our patients was homeless and had an alcohol addiction, much like this patient, John. He came in once and then routinely missed his next several appointments. And when he did finally come in again, he came in accompanied by a case manager. And this case manager seemed to act as a support system for him to attend his appointments and help him get the care he needs, while also holding him accountable to attend those appointments. So having a case manager attend doctor's appointments with a patient is likely not a sustainable long-term solution, but in the short term, it can provide the critical support that this individual needs. Because John has a team of people who care about his health and want to provide resources to him, he would have greater trust in his providers, which is critical for a healthy patient-provider relationship. Trust in healthcare providers is a foundation for him to seek further care in the future and continue his path back to wellness. So that is it for our presentation. Thank you very much for tuning in and for your time today.